Welcome to MenopauseWize, your go-to podcast for all things evidence-based in the menopauseverse. I am Dr. Sukhpreet Patel, an MD gynecologist, a menopause health advocate, a postmenopausal woman, and the founder of MenopauseWize. And I'm so excited to have you join us on this journey. Whether you're a healthcare provider looking to stay on top of the latest evidence-based practices, a woman navigating your own perimenopause or menopause journey, or a partner or family member eager to support a loved one, this series is designed with you in mind. Our mission through MenopauseWize is to close the menopause knowledge gap by bringing you the latest research, expert insights, and practical advice, empowering you to make informed decisions about menopause and perimenopause. Hello and welcome to today's episode of the MenopauseWize podcast on changes in the FDA black box warning. What does it mean for women and their providers with Dr. Shafeena Premji. Dr. Premji is a nationally recognized menopause expert and women's health advocate based in Calgary, Canada. She is the founder and medical director of 3 women-centered clinics, including Milestone Menopause Center of Southern Alberta, opening in January or February of 2026. As a sought-after speaker, educator, and media contributor, she is known for translating evidence into empowering, accessible care for midlife women. Dr. Premji also serves in national leadership roles, including with the Canadian Menopause Society and the Menopause Foundation of Canada, helping shape the future of menopause care across Canada. So, thank you, Dr. Premji, for joining me in this conversation about the recent removal of the black box warning by the US FDA on all estrogen-containing products, and for simplifying it for our audience here. They're women, they're healthcare providers, and simplifying what it would mean for all of us here. So my first question to you is, what is this black box warning? What was it? Or it's probably still is. And what did it claim to warn women and healthcare providers about?
That's a great first starting question. And I think why I appreciate this conversation is that as a healthcare provider that's watching what's going on online, I'm beginning to feel that a lot of the conversations are just too high level for the general public, that they may not actually be able to follow what all of this means, which is why I think it's important that we have this conversation, because we need to simplify it for the average woman who is very confused about what all of this information about menopause and hormone therapy means. But in a very simplistic way, when you go to your doctor to get a prescription for hormone therapy, whether that's something that is absorbed through the skin or the mouth, which we call systemic hormones, or you get some sort of a vaginal treatment, a local estrogen treatment to treat your vaginal symptoms, when you get your prescription in the box or from the pharmacist, you will recall that most medications come with a leaflet with very small imprint that explains to the patient what the medication is. It's basically the product monograph, if you want to call it. And the product monograph is a document that is created by Health Canada with every approved drug. And so this black box is basically literally an area on this leaflet, which is all crunched up into a small, wrap within that product that has a big box around it. And it's a warning. And this warning is found in every estrogen therapy product that is available in Health Canada, by Health Canada, available in the pharmacies. This black box has a warning that says this product, this estrogen product, no matter how it's used, whether you take it by mouth, on your skin versus like a patch or a gel, or into your vagina or your vulva, means it's going to have some severe side effects you need to be aware of. Adverse effects and risks. And what are those risks? Stroke and blood clot and heart attack. So when a woman sees this leaflet and is trying to understand what this medication is, and we as healthcare providers tell the woman, we've done an appropriate risk assessment, we believe this is a very safe drug for you, and now you're opening this product and seeing this leaflet with this big black box warning, it really frightens the woman to say, is this actually as safe as this doctor is telling me? I don't want to develop breast cancer or stroke or heart attack or a blood clot. What do I need to know? And perhaps this really isn't for me. And that leaves a woman feeling very confused. And we know that there is concerns around this black box because it may unnecessarily put worry in the woman, but there also needs to be some sort of understanding that hormone therapy is not completely benign either. So it's a very important balance between risk versus not risk.
Thank you for explaining that so simplistically for everyone. Another thing that if you could explain further, you mentioned the use of estrogen vaginally, orally, transdermally in the form of gels, sprays, etc. And how does this, uh, what do they mean for a woman? How different are they in terms of risks? Are they all the same? Do they fall in the same bucket? And does the warning apply to all of them?
That's a great question as well. Systemic hormone therapy means whole body system therapy. That's the easiest way that I could describe it. If you are ingesting your estrogen orally, or if you are applying it to your skin via a patch or a gel, like on your thigh, for example, it is to treat your hot flashes. That is a systemic hormone. It enters the bloodstream. It can have unnecessary risk associated with it, but that risk really depends on your individual profile, your age, when menopause occurred, your medical history, how long it was since menopause happened. So that is a systemic hormone. That is very different than local estrogen, which is a small ovule or a tablet or a cream that we apply into the vagina or on the vulva to treat the vaginal symptoms. Why that's different? Because the amount of estrogen in that product is minuscule. So minuscule that even if you apply it into your vagina or vulva, it does not enter the bloodstream and therefore does not carry the same risk as a systemic hormone, which does enter the bloodstream. When a product like estrogen enters the bloodstream, we now need to worry where in the body could it be going and where in the body could it be increasing unnecessary and undue risk.
Thank you for explaining that once again. Why was there, if you look back historically at the black box warning, what was the basis of having this black box warning on all estrogen products?
This goes back over 20 years. And for those women who have been really researching and understanding menopause in the most recent years, a large study called the Women's Health Initiative is really what triggered this big warning to show up on estrogen therapy products. And I'm going to try and simplify the Women's Health Initiative. It began in the early 1990s, I would say, and this study was the largest study looking at women to understand whether the use of hormone therapy has an ability to decrease the risk of chronic disease. So they were trying to understand, would hormone therapy potentially decrease the risk of stroke or heart attack or breast cancer or colorectal cancer? What were the protective effects of using hormones? The study had women between the ages of 50 and 79, with the average age being 63. That means the majority of women, the average age, these women were already well into menopause, more than 10 years from their final period, because we know menopause occurs around 51. The women in the study were at the average age of 63. These women in the study had either a uterus or no uterus, and the women in the study were of all different sorts in terms of their medical backgrounds. Some were smokers, some were diabetics, some had other cardiovascular risk factors like high blood pressure, and we're using oral estrogen and a progestogen to see whether or not the form of the hormone therapy would reduce chronic disease risk. And so what happened with the study is the women who were in the study were not symptomatic. They were not having hot flashes. They were using it to see if there was going to be benefit. And unfortunately, as the study progressed, women were beginning to develop adverse effects like stroke, like heart attacks, and like breast cancer. So all of a sudden, this information was leaked to the media, and the study came to an abrupt halt. But the problem with it is that when it was leaked to the media, the findings were generalized to all the women at all the ages. And that is a problem because we recognize that when we look back at that same study and we break down the risks of these events for the 50-year-olds, the 60-year-olds, and the 70-year-olds, the findings were very different. And it was really the women who were older in their 60s and 70s where we were seeing an absolute increased risk of these events. not so much in the 50-year-olds. But even the women who were having these events, the absolute risk was still very small. But it wasn't understood to the media, and that's why all of this fear has come, because the information and the data that was collected was inappropriately sent out to the public, and therefore a fear of hormone therapy came into play, and that's really what prevented women from being comfortable and healthcare providers feeling comfortable prescribing hormones.
Thank you. That's one of the best explained WHI explanations that I've heard. It's simple and easy to understand. Um, Going back to, you mentioned this was generalized. The information from the WHI was generalized, and that was the basis of the black box warning across all products, including vaginal estrogen and including transdermal preparations. And having seen it being generalized in the past for the black box warning across all estrogen products, and now its removal again being generalized universally across all estrogen products. I'm curious to know your thoughts about it.
I think it's a two-pronged sword. It's amazing that it was removed for all the vaginal estrogens, because we know vaginal estrogen does not enter the bloodstream and is very, very, very safe and very, very, very effective in treating genitourinary syndrome of menopause. Those women whose quality of life is affected by vaginal dryness, burning, sandpaper-like, sensation, urinary infections, bladder urgency and frequency, and pain with intercourse. These are really quality of life measures that really affect women, for which we have very safe therapy, vaginal estrogen that does not enter the bloodstream when used in the appropriate dosages. It's amazing that this warning on the leaflet has been removed, because now we can tell patients not only what we are telling you, it is parallel to what's showing in the product monograph. Amazing. However, the systemic hormones, like the oral tablets, like the transdermal gels and patches, there's still nuance there. Patients and women have to be careful. Hormone therapy is very safe and very effective, but it does require a doctor to look at your medical profile and help you understand which formulation, which dose, and which regimen is safe for you. And by removing that black box warning, it's almost like this panacea of every woman, no matter what your background is. It's a one size fits all, you are good. That is not the case. So we really want to reassure women that there is appropriate therapy, but it does require some assessment and some nuance by a physician to help you understand the appropriate treatment recommendation for you as a woman, individually and personalized.
Yeah, absolutely, absolutely. There is so much nuance to prescribing hormone therapy, and you're so right about this one size fits all. So one size fits all with formulation, with dosage, with also age, with respect to age, prescribing under 60 versus above. Not that it's forbidden, but I guess it's a little more complicated than that.
Mhm.
But also the removal of the black box warning from the estrogen products. Considering from the WHI data and data beyond, we do have evidence that some burden of breast cancer risk is borne by the progestogen that is prescribed to women along with the estrogen if they have a uterus. How does that solve that problem per se? Um, do progestogens carry a warning as well? If you've been struggling with vaginal dryness, discomfort, painful sex, or recurrent UTIs, or if you're a healthcare provider who wants to feel more confident about diagnosing and treating the genitourinary syndrome of menopause, check out our new courses at MenopauseWize.thinkific.com. For women, there's VaginaWize, with clear, simple lessons on how to choose the right lubricants and moisturizers, how to use vaginal estrogen effectively after discussing with your provider, what daily habits actually help, and even downloadable guides with trusted product recommendations for both India and North America. For providers, there's GSMWISE, with evidence-based, guideline-driven strategies to diagnose, counsel, and treat GSM with confidence, including practical guidance on all treatment options from over-the-counter to prescription drugs. So visit menopausewise.thinkific.com to learn more, or look out for the link in the show notes. I'll see you there.
I actually don't know if progestogens have a black box warning. I'm not sure. For example, like if you were to open a Prometrium or a say Provera, I actually haven't looked. I'm not actually aware. Are you aware?
No, the Prometrium that I've received from the pharmacy in Canada usually
Yeah.
comes in that little orange box and
Right.
it's got
Right.
nothing on it. So
Yeah.
I've never seen it with that, but I've always wondered about it. We go on about the black box warning with the estrogen, and there's this breast cancer risk mentioned on it, and it's becoming more and more clear with time that it's probably the progestogen bearing
Mhm.
that risk, that burden, and how come we don't have a warning that goes with it? Now I thought perhaps something about it, but
I mean, that's a
I
really
guess
good
that's
point, though. That is a good
mm,
point because women do not recognize, they think when they think breast cancer, they think estrogen. But you're right, it's actually the combination of the estrogen and the progestogen that is increasing that risk for breast cancer. But it's a very modest, minimal
right,
risk,
right,
right? So when you think
right.
about all the risk factors for breast cancer, what women don't also recognize is that having an increased BMI or drinking 2 to 3 units of alcohol per day is the same relative risk of breast cancer as being on hormone therapy. So when we put some of this into context and perspective and tell women that yes, hormone therapy, the combination can increase the risk, we also need to think about what you're doing in terms of your lifestyle. The other big risk factor for breast cancer is your breast density. And again, women don't recognize their breast density. When you get a mammogram report, like in Alberta, it'll say you have a normal mammogram, and somewhere at the very bottom, it'll have a small commentary about your breast density, but it's not actually explained to women, and many healthcare providers don't recognize that as an individual risk factor for breast cancer. It's the second highest risk after the BRCA mutation. So, thinking about breast cancer, we have to put that into context. What are the risk factors? Alcohol is one, an increased BMI is another, your breast density is another. And then, yes, there is a small component of hormone therapy, but it's a modest risk, but it's still something we need to explain to our patients.
Absolutely, and that we can reduce it by exercising a little more. So
Absolutely.
that too. Yes. So thank you for explaining that. Coming to varying risk for different women. Like I'm just going to reiterate it just so that it's clear because I've been approached by women asking, oh, that means hormone therapy isn't risk free, and could you expand on that a little bit? That does removal of the label equate to hormone therapy being risk free?
I would say absolutely not. I think, like any other medical condition or any other thing that we treat, there is a reason why there's a prescription. There's a reason why you have to have the discussion with your doctor because not every type of symptom is menopause related either. And so women need to recognize, and we need to be diligent in our assessment when women come in with symptomatology, that it's not always just hormones that are going to fix the problem. And if hormones are an indication and there is no contraindication, all of that requires an algorithm. And if we had a perfect algorithm, it would be out there. But it's not.
Great.
Why is
Great.
it? Because every single woman is so different, and this is very complicated. That's why it requires a discussion with the patient and the physician, and it's about shared decision making. Every woman's risks, every woman's goals, every woman's preferences, every woman's insurance coverage is also different. So we really need to be telling patients that trying to find a provider that can provide you evidence-based information, that listens to you, that hears you, that understands you, and then coming up with a plan that's collaborative, that you feel that you are also, an important player as well as the physician. That's how this decision around hormone therapy happens. It's not just, a one-way approach. And that's why to say hormone therapy is completely risk-free, I think is a a no-no. I think it's very risky to say that because there's so much more involved.
Absolutely. Absolutely. Thank you. Thank you for that. About the US FDA removing this black box label, what does it mean for Health Canada? What does it mean for women in Canada and providers in Canada?
Well, as a board member of the Canadian Menopause Society, it's one of our missions to advocate for Canadian women and healthcare providers as well. And so this will allow us the opportunity to reach out to Health Canada and ask, what are we doing in Canada and what options can we do to help maybe make a change on our labeling as well. So I think it's going to open the doors for multiple countries to reassess our labeling, but perhaps do it in a way that really takes into account the nuances of systemic hormones without putting the unnecessary worry and risk with the local vaginal estrogens.
Wonderful, wonderful. Thank you so much. And finally, if you had three things to share with our women today, they could be related to the black box or not, but you are a powerful voice in Canada when it comes to women's health and menopause care, and how beautifully you've been spreading evidence-based information amongst women here. And if you had three things to tell everyone, not just women in Canada, but to women everywhere.
That's a hard one because I have so much to share, but I think one thing that I would say is that we as women deserve to have the knowledge and the empowerment to know what will happen when menopause occurs. This is something we cannot avoid. And for some women, it occurs naturally, and for other women, it occurs without us. It occurs out of circumstance, like surgery, like cancer, where you've taken a chemotherapy that's affected your ovarian function, or you've had your ovaries removed for another reason, or you just may go into menopause earlier than expected. We as women need to be prepared, which means that we as healthcare providers also need to know how to counsel our patients. I believe what we need, like we have a growth check for children, we need a menopause midlife assessment, a midlife growth check, if you want to call it, between 35 and 45 to allow us to have this very important conversation with women about what healthy aging looks like in menopause, because we are living 30 to 40 years of our life in menopause, and we have so much to offer society. We need to be able to know how to care for our bodies well before this actually occurs so that we're not afraid and we have the tools and the knowledge and the education to be able to move forward in that next chapter of life with confidence. So that would be my first message. My second message is that I think as women, when we pass the reproductive years and we're living for our families and our children and our employers and our job, we often sacrifice our own well-being and health. And I think that it's really valuable as women that we really begin to check in with ourselves early on in the process to know how to care for our health, because it's really easy to let go. But those small lifestyle interventions that we can do where we make ourselves a priority will actually give us the ability to present and be a part of the rest of our responsibilities and our job roles as as mothers and daughters and employees in a better way, because we are taking care of ourselves. So really checking in with ourselves and making sure that we are our most important advocate. And then the third thing would be hormone therapy is very effective when it's indicated for bothersome hot flushes and night sweats, but it is not a game changer. I would say the game changer is the combination of using hormone therapy when you need it for your hot flushes and night sweats or for the genitourinary symptoms, but that your lifestyle interventions and the consistent changes with respect to alcohol and smoking and sleep and stress and all of that is just as important, if not more important, to really age well.
Wonderful. I think that covers the entire menopause health module for most women. But you mentioned indications for hormone therapy, and I'm just curious, is there a reason prevention of osteoporosis wasn't something that you mentioned? the
Yes,
reason for
the
that
prevention of osteoporosis, of course, that is an indication in the US. We don't have that indication in
in
Canada.
Canada?
However, I do know that menopause in and of itself is a risk factor for bone loss. And so talking about bone health in terms of vitamin D and calcium and weight-bearing exercise is very important, and having a conversation about what we can do to optimize or manage or maintain our bone density is extremely important. And if there is a potential benefit of using hormone therapy for preventing osteoporosis, that is still also on the table. However, I have seen many people or many women think that once they have established osteoporosis, we should be using hormones, and that is not what it's for. It's for the prevention of osteoporosis.
Okay, so thank you for simplifying the black box warning for all of us, and thank you for explaining what it really meant and what it's changed, this shift in regulation.
Thanks again for tuning in to MenopauseWize. Stay informed, stay empowered, and I'll see you in the next episode as we continue to navigate the menopause journey together. If you're a healthcare provider interested in collaborating with us or have insights to share, we'd love to hear from you. Please email us at info@menopausewize.com. That's wise with a Z. And before we go, a quick medical disclaimer. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult your physician or a qualified healthcare provider before making any decisions regarding your health or any medical treatments discussed in this podcast. While we strive to provide accurate and up-to-date information, this podcast does not replace professional medical consultation, diagnosis, or treatment. If you have any concerns or symptoms that require medical attention, please seek advice from your healthcare provider.